So we're going to do this point right here on your foot. This one's really helpful for pain, and it's also very soothing for your mind. So it'll help you relax a little bit better. And so what I'd like you to do is just take a few deep breaths and relax into the table. And you might feel a slight pinching sensation, a little bit of pressure, but it shouldn't be painful for you. And a nice deep breath, and when you're ready, let it out. And there you go. I'm just going to stimulate this needle a little bit. And that should be good. How did that feel for you? Barely felt it. Good. That's what we like. Pain is probably the #1 condition that people get referred to us for, but in addition to pain, we also treat anxiety, we treat insomnia, we treat digestive disturbance, we treat imbalance, or what we might call a disharmony in your immune system, so we can regulate immune functioning. There's many things that we treat, hormone imbalances, etc. Acupuncture is really a very broad spectrum kind of a treatment, but it is very effective for pain, and so that's often one of the big things that we focus on, is really trying to get people pain relief. There are a number of ways that acupuncture works, a number of different theories about it. The way that I like to think about it the most is that what we are doing is twofold. We're retraining the body neurologically and how to perceive what is going on with different nerve impulses that we're having. You know, pain is an adaptive process that we have. If we put our hand on a hot stove, we get pain right away that says, ouch, that burns, that's not a good thing to be doing. Pull your hand off of there so that we don't get damaged from it. That's really a valuable survival tactic that our bodies have just built in. So acute pain like that, it's really important to be able to have that. With chronic pain, however, our brains are getting tricked into thinking there's a threat present, but there really isn't one. That threat is long past, months ago. That what was causing that pain has sort of resolved, and yet it's as though our brains are caught in a loop, and we keep getting the pain over and over and over and over again. Acupuncture has been shown to be very effective in retraining the brain in how it perceives those impulses, so that it's no longer perceived as pain, but instead we look at it more as pressure or perhaps a temperature change or something like that. So it's really a matter of restructuring how the brain looks at those stimuli so that it's no longer perceived as pain. That's for chronic pain. For acute pain, we use a few different strategies. Sometimes we do things that increase the endorphins, that it changes the way the neurotransmitters are being expressed in the brain so that we perceive that pain a little bit differently. It also reduces inflammation. It improves blood flow, circulation, so that areas of the body that perhaps are being underserved by our circulatory system, we start getting more blood flow to those areas, as well as increasing the uptake of the red blood cells so that we're getting more oxygen there, more nutrient there, and thus more healing. And just to let yourself relax into the table.